So based on those assessments that we conducted and the answers that you provided, it does seem like you experienced a concussion during that blast.
Are you sure it's a concussion? I've always been told that basically you kind of got to be knocked out in order to have a concussion.
Sure, yeah, often when people experience a concussion, they do lose consciousness. However, concussions, or what we also call a mild traumatic brain injury, they can also involve a feeling of being dazed and confused. Some people say it's kind of like getting your bell rung or seeing stars.
A brain injury sounds pretty serious. I mean, shouldn't you be taking scans or something?
That's a good question. I know the term brain injury can sound pretty intimidating. We tend to use the term mild traumatic brain injury or mild TBI interchangeably with concussion. And brain scans are actually not typically used when diagnosing a mild TBI because there aren't actually noticeable changes. So when someone gets hit in the head or was nearby a blast like you were, we'll usually diagnose a mild TBI based on their description of the event as well as symptoms.
Okay, so symptoms. What should I expect regarding symptoms? I mean, I know I have had the headaches, but what else?
Sure. Headaches are common symptoms after a concussion. Additionally, you may experience other symptoms like dizziness, difficulty with balance, blurred vision, sensitivity to noise or light. Sometimes people may feel nauseous or easily fatigued. After a concussion, sometimes people will complain of disturbed sleep. That's a really common complaint. For most people, these symptoms will resolve within a few days or weeks, but for some people, they may last up to about 3 months.
Okay, well, what about other symptoms? Let's just say that perhaps the headaches and the other symptoms, they go away eventually. Will there be lasting effects? I mean, I hear these stories about these guys, that have these brain injuries, and they just say that their mind doesn't really work quite right after that, and they find themselves not really being able to remember anything.
That's a really common concern that we often hear from patients. Some people do notice those cognitive symptoms after a head injury. These can be things like difficulty concentrating or paying attention, feeling kind of slowed, or having trouble remembering things. I know this can cause some anxiety, but something that's really important to remember is that our thoughts and perceptions about these symptoms are incredibly powerful. So let me give you an example. So how often do you forget where you put your keys or your phone?
All the time.
Yeah, so this is something that's very common for a lot of people to do from time to time. Before a head injury, it's just something that you would probably brush off and forget about. But then after a head injury, when you may have some perceptions or worries that you're damaged, these small events seems like a sign that your brain is not functioning correctly. But actually the good news is that cognitive symptoms like memory or attention problems typically resolve within a few weeks. Having long-term cognitive problems is not typical.
I have also noticed that I've had a really short fuse. I mean, I find that I'm a lot more irritable compared to what I used to be.
Yeah, that's another common symptom we hear following a mild TBI. Also, sometimes mild depression or a loss of interest in activities. But like those cognitive symptoms we were talking about, these symptoms often resolve too. But be sure to let me know if that feeling of irritability gets worse or if it's accompanied by feelings of depression.
Okay, well, what if I continue to not feel right?
Yeah. If you continue to experience cognitive symptoms or any emotional concerns beyond a few months, it's actually most likely not a direct result of the head injury, but it could be an indirect result of something that accompanies the head injury. So let me give you another example. After a concussion, people often experience difficulties with sleep. And we know that if we're not getting enough sleep, it's really harder to remember things and pay attention. So this could be due to lack of sleep more so than the head injury itself, if that makes sense. But if after 3 months you still don't feel quite right, at that point we'll start looking at other conditions that may be contributing to those symptoms. Does that sound good?
That sounds good.
Great.